So in nutshell, you can just tell us, brief us about what are the indications. See, because now radiation oncology, though it is very helpful and though everybody feels, okay, this is the best option perhaps available, but it has got its own limitations. So which are the indications of which are the disorders which come under your purview?
Okay. We have moved from a time when I trained, there was radiation was the major treatment modality available in the country. There were not surgeons who were trained in cancer surgery. There was no chemotherapy available in the country. Fortunately for patients, today we have moved to a stage where it's a multidisciplinary team. Most cancers today are addressed combinedly. Some amount of surgery, some amount of radiation, some amount of chemotherapy in various permutations and combinations.
So it is like a teamwork.
It's like a teamwork. And the patient has become the focus.
Yeah.
Previously, the doctor was the focus.
Absolutely.
Now you have shifted the focus very nicely to the patient. So what does this patient's cancer demand? If it demands doing surgery first, we do surgery first, then give radiation and then chemotherapy. There are instances where we do it the other way around, where chemotherapy is given first. Roughly 65 to 70% of all cancers pass through radiation at some time during the cancer journey. It may vary, it may be first treatment, it may be after surgery, it may be after some chemotherapy, but some time or the other, we do give radiation in about 70% of patients.
So I would like to ask you one more thing, sir, about CyberKnife. What is this CyberKnife? How it helps people, and what is the new aspect which has come in the radio, radio imaging as well as this management from through radiation?
I'm very glad you asked. The word CyberKnife,
because your institute is very famous for that.
It would imply that there is a knife involved somewhere. There is no knife.
Correct.
But the damage we do with the precise radiation is equivalent to what a cancer surgeon's knife does. And therefore, it's called CyberKnife. Now, CyberKnife is a linear accelerator, which is X-rays that I told you about, but it is mounted on a robot. Interestingly, this robot was borrowed from the automobile industry, Mercedes-Benz factory.
I see.
And those robots move very fast. If you have seen an automobile factory, they move very fast.
I see.
So they had to slow it down 100 times so that it moves where the patient doesn't get scared. And now, because it's a robot, you have 6 degrees of freedom. So technically, potentially, from 1250 different directions, you can focus radiation onto a particular point. And because there is imaging in the room, every time you're seeing where you're hitting the radiation and then hitting even that tiny beam of radiation. So when you're combining 200, 300 beams from different directions, you're building up a very high dose of radiation at the site that you chose. But surrounding structures are completely spared of radiation.
It means highly precisely target
precise. It's sub-millimeter precise.
I see.
What you do is you take a CT scan right in the beginning, and the software reconstructs an X-ray out of it, which is called a digitally reconstructed radiograph, DRR, and it stores it.
I see.
Now the patient comes and lies down on the couch. You take X-rays in the room, which are at right angles to each other. And then that X-ray is superimposed on the original X-ray. And the software will tell you, you are 2 millimeters off, you are 1 degree off. And unless you correct it and bring it to that, the machine will not come on. It can be irritatingly precise. It has taken me sometimes 2.5, 3 hours to just get the machine to accept the. So it's a very, very accurate technology. But certainly, in this country, we can be proud that we have that technology available.
So, in fact, I must say that such precision, which would have definitely even a good or the best surgeon would have missed otherwise on table. Because sometimes it is very difficult to demarcate what is a normal tissue and which is the human, because there is a very fine line. But what you have explained to us, finally I can say that with this precision, there are practically no chances of missing.
Absolutely right. And you're sparing the normal structure. That's the other major advantage.
Yes, sparing the normal structure. So you are not going to get affected through that.
That's right. So, the third advantage of using this, because it is so precise, I can give a very high dose of radiation in each treatment. So normally, let us say prostate cancer, where it would take 40 treatments, 5 times a week means 8 weeks.
Correct.
With CyberKnife, it is so precise, I can give a high dose of radiation, finish the entire treatment in 10 days. Alternate days, 5 treatments, treatment is done.
Correct.
So it's a very big advantage.
Yeah, yeah. One more thing I want to ask you, sir. Whether, as you have rightly said at the beginning, see, once a person is diagnosed or detected as a cancer, a lot of psychological trauma also comes into picture. We have nicely described, but I want you to little highlight it, because finally, apart from our financial factors, family life, social life, your productivity, what affects at large is our psychological setup, I should say. So I want you to touch this issue.
That's a very excellent question. There is a new science which is developed, which is called psycho-oncology, which addresses the psychological impact of cancer, not just on the patient alone, but the patient and the family. And that is now developed to a stage where they are saying psychological evaluation needs to be the 6th vital sign, like you have blood pressure, temperature and so on. It should be the 6th vital sign, and there are certain scientific ways of psychological, these are not psychiatric.
Correct.
Psychological issues which are handled by clinical psychologists whom we train to be psycho-oncologists. So it's a very, very upcoming field. Ultimately, my own feeling is we need to incorporate psycho-oncology as an integral part. It's as important as radiation or surgery or chemotherapy. And we have a center in Bangalore, Center of Psycho-Oncology, where we train people, where we deliver the service, and also we do research in this.
It is really interesting, sir, because what happens, we often, every doctor says, okay, don't worry, this is a treatment and don't worry, you'll be all right. Everybody, but patient also knows the doctor is giving me a false hope. At least he thinks that way. However, he may be loyal to the doctor or whatever, he may pretend to that, yes, I'm convinced with your answer. At the core, he's really disturbed. And in fact, I'm very much impressed that you have a proper team to evaluate this, and you can build him up so that he is psychologically prepared to face this challenge, I can say.
Absolutely.
And one more thing you have mentioned, it is become a 6th vital sign.
Yes.
So means his role is not just any, in fact, he has a very major role to play.
Yes.
Patient has to be psychologically prepared for all this. And one more thing what I would like to ask you, sir. Sir, once you go through this radiation and other this thing, how much time usually they take? Because people feel, okay, now once I go radiotherapy, then it means whatever side effects will be for a longer time, or so what are the myths related to this, or how safe, in short, or how time saving as well as financial aspect can be? Because once morbidity is less, and definitely your outcome, you can join your work. So all this part I want you to address.
Well,
sir.
During radiation, whether it's 6 weeks or whatever time, we encourage them to continue to work. They can come from schools, they can come from banks, wherever they're working. It takes about half an hour, 40 minutes to deliver one treatment. We treat Monday to Friday, Saturday, Sunday are rest, and so on. So we encourage them to continue with normal life. What I say to them is, this is not your life.
I see.
This 20 minutes, half an hour, don't make that your life.
Correct.
Make it a part of your routine.
Absolutely.
Like you go to the gym for 30 minutes, come to the hospital, take your treatment and go, because there are no side effects involved. You asked a very important question of what happens in the long run. I can't say, I would be lying if I said it's 100% safe. There is no such thing as that.
Correct.
But overall, between 5 to 7% of patients we treat will have long-term side effects of radiation, which is the same with any drug, which is the same with any surgery. So radiation is no different. It is as safe as any other treatment that you can think of today. One other point I want to mention. People ask me, what are the chances of survival?
Correct.
And somehow there is this American thing coming into Indian medicine where we want to quote statistics. 60% chance, 40% chance. Now, the thing to realize is this particular patient who's sitting in front of you is not a statistic, he is an individual.
Absolutely.
Whatever happens to that person is 100%.
Correct.
There is no such thing as 99%.
Absolutely.
Therefore, what you want to say to the public is, please don't look at everybody's net savvy these days. They go onto the net and say, okay, my father has a 10% chance, 20%. And when they come back to me and I say, okay, how do you know whether your father is in that 30 or the 70?
Correct.
There is no test.
Correct.
What you need to keep your focus on is quality of life.
Absolutely.
Don't go into statistics.
Absolutely.
And that's a very major thing, particularly the younger group where nowadays every house has somebody in the software.
In fact, sir, I will just like to add, sometimes we go to this thing and after reading through the net and all this information, so-called data savvy or techno savvy people, they go to the doctor and they ask like, Dr. Chan, or these are the chances which I read. But I always say that suppose if I could take you to a surgeon who has completed 10,000 surgeries, out of them 9,999 patients have survived and only one person has died. but unfortunately he is your relative.
Yes.
Then you tell me what is your interpretation.
Exactly.
So study it may be less than 1%, but still because you are attached to this one person, not the person.
Yes.
That makes the total world around you different place, and your statistics doesn't matter anything.
Absolutely.
So finally, what we are trying to do best has to be with person orientation, not the statistical data orientation.
Absolutely right.
Because as you have rightly said, sir, we are treating the individual, not the statistical figures.
Yes.
So one more thing I want to, before we wind up this issue, sir, one more thing I just want you from where we stand, because now there are hardly few centers in especially country like India where all this type of newer facilities are available. Like see, you are having CyberKnife, you are having other facilities for radiation. So how we are coming up and how to face the challenges ahead?
Okay. Today, unhesitatingly, India has overall cancer facilities equal to anywhere else in the world. You don't need to go anywhere else, right here in India.
Yes.
2, over the past 10 years, we have seen a tremendous increase in sophisticated treatment facilities for cancer.
Yes.
So previously there were only 1 or 2 in the country.
Yeah.
Our aim in HCG is to take this to the doorstep. So we have 28 centers across the country, tier 2 cities, tier 3 cities.
I see.
So we don't want patients to travel long distances. We want to take the treatment to their doorstep. So things are really changing very, very rapidly, I'm glad to say, in this country.
Okay. Thank you, sir. One more thing before we wind up, I want, what is the take-home message at this point of time when the people, as that cancer name itself, people makes scared. I want you to tell them in precise few words how to face this challenge in the today's world, in today's scenario.
Okay. What I would really urge all the viewers and all their families, whoever is watching, cancer today is a completely curable disease, rest assured. 2, cancer treatment is available right here in this country, you don't need to go anywhere else. 3, cancer treatment during as well as after, you can completely lead a normal life. So you don't need to fear the disease anymore. 4th, there are other support facilities, like I said, for psychological support and so on and so forth. So you can actually sail through cancer treatment. Please treat this like any other disease, like you would treat a common cold or a cough or something like that. Having said that, don't neglect yourself.
Absolutely.
Go to a doctor when the symptoms persist, not because it's cancer, but in case it turns out, at least you'll be able to be treated in time so you can lead a normal life.
Sir, thank you very much. Really, you have taken all the efforts and touched this issue in a very beautiful way. I must thank you on behalf of all the viewers for giving us this opportunity to interact with you, and happy that whatever message you have to propagate will be taken by the people with the right spirit, and future days will be brighter for all cancer patients. Thank you very much. So nice.
Thank you.
Namaskar.